to start from the beginning. Oh. I have to run then. Just check the once, otherwise I have to. Okay, now, but it is not enlarging, ma. Okay, again the retake. Hmm. Okay, Puerperal. Good morning, everyone. Today the topic given to me is puerperal sepsis. So everybody knows that puerperium is a time when after the time after the delivery, after the 6 weeks, it can be a normal puerperium or it can be an abnormal puerperium. So abnormal puerperium, there is infection of various systems that involved. It can be a just a puerperal fever or uterine infection or breast infection, puerperal urinary tract infection, wound infection, respiratory tract infection, pelvic septic thrombophlebitis, puerperal venous thrombosis, or a psychological disorder. Okay, so what is puerperal fever or the childbirth fever is the temperature of 38 degree or 100.4 degrees Celsius on any of the two of the first 10 days of puerperium, excluding the first 24 hours. It can be the causes can be a uterine infection, breast infection, UTI, wound infection, respiratory tract infection, or the thrombophlebitis. Puerperal sepsis. This is the topic which I'm going to take in detail today. It is usually come as a question, puerperal sepsis. So it can come as a 5 marks or 10 mark question. So first we will learn about the definition. The definition is an infection of genital tract which occur as a complication of delivery is termed as a puerperal sepsis. So nowadays there is a decrease in the puerperal sepsis. The reason being there is an improvement in the OBS care all over, and as well as that there is a wide variety of antibiotics which we are using nowadays. That's the reason why it is being decrease. So puerperal sepsis may be what are the causes? It is due to the infection inflammation of the endometrium, the endomyometrium, and the parametrium. Okay, this is usually the vaginal flora. What we have is the deodorants bacteria, candida, strep staph, and the E. coli, and sometimes Clostridium wilchi is also there. Okay, pathogenesis. How does the puerperal sepsis occur? Pathogenesis, it occurs because of the breach in the cervico-vaginal mucous membrane, and there is a placental side which is open wound, and then there will be clot after the delivery, which is a great media for the growth of the bacteria. So what are the predisposing factors? Predisposing factors are we have genital factor and post intrapartum factor. Antenatal factor, we have the malnutrition, anemia, preterm labor, PROM, and the chronic debilitating diseases. Interpartum factors, there are certain factors that may be due to a repeated PV examination, PPROM, maybe the lady is dehydrated and a ketoacidosis is there during the labor, or a traumatic operative delivery is there, then she can end up into having a puerperal sepsis. There may be a hemorrhage, that is can be a APH or a PPH, that is antepartum hemorrhage or a postpartum hemorrhage. If there is a latent placental bead after the delivery, then or if there is a placenta previa or cesarean section, the chances of puerperal sepsis is more. Okay, these are the predisposing factor. Microorganism, for the puerperal sepsis, it can be aerobic or anaerobic. Aerobic bacteria includes the gas, group A and group B, and sometimes there are the other stuff like Staphylococcus pyogenes, others like the Staphylococcus pyogenes are the E. coli, Klebsiella, Pseudomonas, Proteus, and Chlamydia can also cause the puerperal sepsis. Anaerobic includes the Streptococcus, Peptidococcus, bacteria, Fusobacteria, Clostridia. The mode of the infection is usually endogenous, but it can also be autogenous or an exogenous. Pathology. The types of infection mostly is the perineum, next comes the vagina, cervix, and the uterus. Okay. Pathogenesis. Okay. The incidence of puerperal sepsis is more during the cesarean section, it's around 10%. During the vaginal delivery, it's around 1 to 3%. The placental side is the affected side in this cases. Okay. The risk factor, as I told before, is mostly the obesity, diabetes, and the nutritional abnormal malnutritional status like the anemia that increases the risk of the puerperal sepsis. So this is a flow chart showing how it is being introduced. When we do PV examination or cervical mucosal mucosa it's breached, and there is the normal flora that is inoculated into uterus, and there is after the delivery there is a surgical trauma, or if, and there will be suture materials, and there will be devitalized tissue and blood and serum, which are a medium for the growth of the bacteria, and thus lead to the bacterial proliferation. Clinical features, if there is a case of puerperal sepsis, we need to identify. So a clinical feature is a must, we should know. Okay, if there's a local infection, how does it present? Uterine infection, how does it present? If it is a spreading infection, how does it present? It's very important to know all these features. So if there's a local infection, there will be localized of temperature, patient will be having a malaise and ache, and a local wound will become red and swollen, and pus from the wound may also be present. In case of uterine infection, which is a mild infection, the patient will have a temperature, pulse rate will be increased, lochia will be offensive and copious, in uterus may also be a subinvoluted, and there will be tenderness when of the uterus. In severe infection, the patient will be having a fever with chills and rigor, the pulse will be very high, and lochia will be scanty and odorless, and uterus of course will be tender and soft. Spreading infection, if there is a spreading infection, it can be pelvic peritonitis, peritonitis, or it can be a pelvic abscess can be there. Then in those cases, how does the patient present? Pelvic peritonitis, patient present with pyrexia, this fever with a increased pulse rate. The patient will have abdominal pain and tenderness. Vaginal examination, there will be fornical tenderness, and cervical motion tenderness will be there. If there is a pelvic abscess, then there will be a bulging mass in the POD. There's a pulse of Douglas. Generalized peritonitis, the patient will have a high fever with rapid pulse, vomiting, and generalized abdominal pain may also be there. Patient will be looking much more ill and dehydrated. Abdominal examination, there will be tenderness, and distension may also be present. And rebound tenderness may also be present in case of generalized peritonitis. Parametritis is usually present on the day 7 to day 10th of the after the delivery, and the patient usual complaint will be a chronic pelvic pain, will be a constant pelvic pain. Okay, and there may be tenderness in the hypogastrium. Investigation. So in case of the patient, if we have a patient, how do we investigate? First thing, we have to take about the history taking is very much vital. We have to ask about we have to find out whether the patient is having any antepartum or intrapartum risk factor. After the history taking, we do a general examination and systemic examination. Systemic examination is very important in case of the puerperal sepsis, puerperal pyrexia, because some other system like respiratory system can also be involved after the after delivery in case of the puerperal sepsis. Okay, investigations, we need to take a high vaginal swab to know if there is any growth of the bacteria, and then second, we have to know, or we have to send a midstream's urine for analysis and culture insensitivity to know if there is any urinary tract system involvement. And we have to have a total blood count. Hemoglobin estimation is also important in order to know whether the patient is actually having a puerperal sepsis or just mild fever from other parasitic organism infections, or then we have to take a thick blood film to rule out the malarial parasite. We have to take the blood culture also, and we have to do a pelvic ultrasound if we are doubting if there is a pelvic abscess. We might have to go for a CT or MRI scan, MRI in case if we are suspecting or thrombophlebitis. Okay, and chest x-ray if we are suspecting that the patient is having atelectasis after the C-section, or if the patient is having a suspecting that the fever is secondary to the COGS, that's TB. Blood urea and creatinine is also needs to be done. Prophylaxis, how do we prevent puerperal sepsis? We prevent puerperal sepsis from starting from the antepartum. During antepartum period, we have to correct all the malnutrition, including the anemia, and we have to optimize the patient's state in case if the patient is having a chronic deliberating disease. Okay, intrapartum, it should be intrapartum. Okay, intrapartumly we should take an aseptic precaution whenever we do a PV examination, and repeated PV examination should be avoided, and if antibiotic coverage should be given, especially during the C-section, as a C-section has a more increased rate of puerperal sepsis, around 10%. And traumatic, if we are having a traumatic delivery, we need to cover with the antibiotic. Then the postpartum period, we have to maintain the lady has to maintain safety precaution for about 1 week, and sanitary pads needs to be used, and too many visitors should be avoided in order to prevent this during the postpartum period. Okay, treatment. So in case of treatment, first what we do is usually it's an infection case. We usually isolate the patient, and the patient is treated with adequate fluids and calorie intake, and there will be charting of the vitals and the amount of fluid intake, output, and what is the amount, and the quality and the quantity of the lochia discharge. Okay, and the antibiotics should be given according to the culture and sensitivity. Surgical wound, if there is a surgical wound, like if this perineal wound, like in case of episiotomy, then it has the wound debridement or might also be required. Okay, retained placenta, if this present, if this more than 3 centimeter, then we might have to evacuate. Okay, if there is a pelvic abscess, maybe we have to evacuate by drain the abscess by using by doing a colpotomy. Okay. Okay, that finishes your lecture for the puerperal sepsis. So first, puerperal sepsis is a question in exam for 5 to 10 or 5 marks or 10 marks. First, definition: what are the how does the what are the normal flora, how does it spread, and what are whether it's a law, what is our clinical features, and what is the investigations, how do you treat. These are the basic points we would like you to write during the exam. Okay, thank you.